Okay, Allie, so how much do you weigh?
120 pounds.
Okay, so any recent weight loss or gain?
Nope.
Okay. Any recent fatigue, weakness, or discomfort? Have you noticed any fever, chills, sweats, or night sweats?
No.
Okay. Do you have a history of any skin disease?
I had eczema right here on my hands when I was little, but since, no.
Okay.
Not recently.
Any pigment or color change in your skin?
Mm-mm.
Okay. So, have you noticed a change in your moles, like color, diameter?
No.
Okay. Any excessive dryness or moisture in your skin?
Mm-mm.
Okay. Have you noticed that you've been, itching a lot?
No.
Okay. Any excess bruising, rash, or lesions? Okay, so have you noticed any recent hair loss or change in your texture?
Mm-mm.
Okay. So nails, any change in the shape, color, or texture? Okay. How much do you expose yourself to the sun?
Not often. I work inside and I go to school inside, so
Okay.
not a lot.
Well, when you do go in the sun, do you use sunscreen?
Sometimes my face makeup has SPF, so.
Okay. Do you use any lotion for your skin?
Yeah, every day.
Okay. Any frequent or severe headache?
No.
Okay. Do you have any head injury or dizziness? Okay. Do you notice any vertigo?
Mm-mm.
Okay. Let's see. Do you have any difficulty with vision?
No.
Okay. Any eye pain or double vision? Do you have any redness or swelling in your eyes? Okay. Have you noticed any watering or discharge?
No.
All right. And do you have any history of glaucoma or cataracts?
No.
Okay. So do you wear glasses or contacts?
Yeah, I wear glasses for seeing distance.
Oh, okay. When was your last vision check or glaucoma test?
Last year.
Okay. Are you coping? How are you coping with that vision loss?
It's fine. I just
Okay.
wear my glasses when I watch movies or drive.
Okay. Any earaches or infections?
No.
Okay. Have you noticed any discharge in your ears?
Mm-mm.
Okay. Or how about ringing in your ears? Okay. Any recent hearing loss?
No.
Okay. Do you have any exposure to environmental noise?
No.
Okay. Any discharge in your nose?
No.
Okay. Have you noticed any frequent or severe colds?
No.
Okay. Any sinus pain, stuffy nose, or nosebleeds? Okay. Do you have any allergies or hay fever?
Not that I've noticed.
Okay. And have you ever noticed a change in your sense of smell?
Mm-mm.
Okay. So do you have any difficulty swallowing?
No.
Okay. Have you noticed any pain in your mouth or
No.
frequent sore throat?
No.
Okay. Have your gums ever bled before? Any toothache or lesions in your mouth or tongue?
No.
Okay. Have you noticed your voice ever going hoarse?
Yeah, sometimes.
Okay. How often do you brush your teeth?
Twice a day, sometimes 3.
Okay. Do you have any dentures or a bridge?
Mm-mm.
Okay. And when was your last dental checkup?
Like 9 months ago.
Okay. So do you have any neck pain or limitation of motion?
Mm-mm.
Okay. Have you noticed any lumps or swelling in your neck?
No.
Or any enlarged or tender lymph nodes or a swelling midline?
No.
Okay. Okay, so have you noticed any breast pain or lumps?
No.
Okay. Have you noticed any nipple discharge or rash? Okay. Do you have a history of breast disease?
No.
Okay. Have you ever had any surgery on your breasts?
No.
Okay. Your armpits, have they ever been tender or any swelling have you noticed?
No.
Any rash or lumps?
I'm allergic to some deodorant, so I can only wear a certain kind.
Okay,
So I get a rash when I wear the kind that I'm not supposed to.
Okay, so just when you don't wear the right. Okay.
Yeah.
Okay, and then do you ever perform breast self-examinations?
No.
Okay. Have you ever had a mammogram?
No.
Okay. Let's see, have you ever had a lung disease like asthma, bronchitis, pneumonia?
Just asthma, exercise induced.
Okay. Do you have any chest pain when you breathe?
No.
Okay, any wheezing or noisy breathing?
Mm-mm.
Right, have you ever noticed any shortness of breath?
Only due to my asthma.
Oh, okay. Let's see. Have you noticed any frequent coughing?
Mm-mm.
Okay. So if you do cough, do you ever cough up phlegm or blood?
No.
Okay. Do you see yourself being exposed to any toxins or pollution?
Mm-mm.
Okay. And when was the last chest x-ray?
I don't think I've ever had a chest x-ray.
Okay. Okay, so any sharp pain in your chest?
No.
Okay, have you ever experienced a racing heart or, have you ever gone blue?
Mm-mm.
Okay. Do you ever notice any difficulty breathing?
Other than when I exercise, no.
Okay. Let's see. So have you ever noticed any shortness of breath while lying down?
Mm-mm.
Okay. And have you ever awoken from like a lack of breathing?
No.
Okay. Let's see. Do you like get up to pee very often during the night?
Mm-mm.
Okay. Any history of a heart murmur or high blood pressure?
No.
Okay. All right. And any artery disease or anemia?
No.
Okay. And when was your last ECG?
I've never had one.
Okay. Okay. So have you noticed any like coldness, numbness, or tingling in your legs or arms?
No.
Okay. Any swelling or discoloration in your hands or your feet?
Mm-mm.
Okay. Do you have any varicose veins or complications? Okay. And then do you notice any leg cramps after exercise?
Mm-mm.
Okay. And have you ever had like a blood clot in your arms or your legs?
No.
Okay. So let's see. How often do you tend to eat in a day?
I eat normally like 2 meals a day and a couple snacks throughout the day.
Okay. Do you have a food intolerance or anything?
I'm not really supposed to eat gluten.
Okay, so gluten intolerance. Do you have any difficulty swallowing or heartburn?
Mm-mm.
Okay. Any indigestion or pain associated with eating?
Only when I have gluten.
Okay, the gluten. Any other abdominal pain or any heartburn?
Mm-mm.
Any nausea or vomiting?
Sometimes I have anxiety, so I get like nauseous when I get anxious.
Okay. If you ever do vomit, have you noticed any blood when you vomit?
Mm-mm.
Okay. And do you have a history of abdominal disease?
No.
Okay. And have you noticed any excess gassiness?
Mm-mm.
Okay. And how often do you poop? Is it just like all right? Like
I poop normally like once or twice a day, and
Okay.
it's
okay.
normal.
Okay. So you noticed like no changes in their frequency.
Mm-mm.
Okay. So any constipation, diarrhea?
No.
Do you use any antacids or laxatives?
Sometimes I'll take a Tums or something if I eat gluten.
Okay. Let's see. So do you ever notice pain when you pee?
No.
Okay. And when you do pee, is it just like a normal amount or is it too much or too little, do you think?
It's normal.
Okay. And do you ever, wake at night to pee, like, very often?
Mm-mm.
Okay. Let's see. Is your urine color, do you notice any cloudiness or anything?
Mm-mm.
Okay. And do you have a history of urinary disease?
No.
Okay. And have you ever noticed any pain in your upper, lower abdomen, your back, or your sides?
No.
Okay. Okay. So have you missed any periods recently?
Nope.
Okay. How old were you when you first got your period?
7th grade, so 12.
12 or 11?
Yeah.
Okay. And let's see. When was your last period?
Last month.
Okay. How long does your period usually last?
6 days.
Okay. So is your period pretty consistent, usually like once a month?
Mm-hmm.
Okay. Is your period ever abnormally heavy or long?
No.
Okay. Do you ever notice any vaginal itching or discharge?
No.
Okay. And when was your last gynecologic checkup?
May,
Okay.
I think.
May. And are you presently in a relationship involving intercourse?
No.
Okay. Let's see. Have you been in a relationship involving intercourse in the past?
No.
Okay. Are you aware of any contact with a partner who has a STD?
Mm-mm.
Okay, or an STI?
No.
All right, and do you have any history of arthritis or gout?
Nope.
Okay. And do you notice any stiffness or pain in your joints?
Nope.
Any swelling or deformities?
Nope.
And have you ever noticed any limitation of motion or noise when you move your joints?
I make noises with my ankles when they move, but other than that, no.
Okay, so just with your ankles. Any muscle pain or cramps or weakness?
Mm-mm.
Do you ever have any issue walking or, doing certain activities?
Mm-mm.
Okay. Do you have any pain in your back or stiffness or limit of motion?
No.
Or do you have any history of back pain or disease?
Mm-mm.
Okay. And, how much walking do you do a day?
A normal amount.
Okay. And do you have any history of a seizure or stroke or fainting, blackouts?
Mm-mm.
Okay. Let's see. Any weakness or paralysis or coordination problems?
No.
Okay. Have you noticed any numbness or tingling? Okay, so have you noticed any loss or in memory or disorientation?
Mm-mm.
Okay. Any nervousness or mood change? Okay. Have you had any recent depression or history of it?
Yeah.
Okay.
And anxiety too.
Okay, so do you have it right now?
Yeah.
Okay. Do you have a history of any mental dysfunctions or hallucinations?
Mm-hmm.
Okay. All right. And do you have a tendency to bleed from often?
No.
Okay. Have you noticed any excess lymph node swelling?
Mm-mm.
Okay. And are you exposed to any toxic agents or radiation?
No.
Okay. Okay, we're almost done here. So we have any history of diabetes?
No.
Okay. Or thyroid disease?
No.
Okay, do you have an intolerance to the heat or the cold?
I get really cold a lot.
Okay, so intolerance to the cold. Do you have a change in skin pigmentation or texture?
Mm-mm.
Okay. Have you noticed any excess sweating?
No.
Okay. Let's see. And do you feel that your weight is appropriate for your appetite?
Yeah.
Okay. Have you noticed any bald spots?
Mm-mm.
Okay. And any nervousness or shaking?
With the anxiety, yeah, I shake. And I
Okay.
get nervous, but
Okay. And then do you take any hormones?
mm-mm.
Okay. So that'll complete my assessment, and thank you for your time. Okay.